Buddy, today is July the 30th. Geez, this month, the summer is going by so quick. 2020. And welcome to the Board of Education's special meeting. This one was called, probably some of you probably found out about it sort of late in the week, but we hope you got notice, and we hope you follow our board meetings and when we have them by going to our website. Everybody knows that website. That's rcsdk12.org. And you can find out a lot about the board's business, but most importantly, a lot about what's happening in your district generally. So we would encourage you to go to that. And as Ms. Wade will tell you, that is the email address, the website address, and that is part of the email address that you send a request to speak to the board. Now we have one speaker tonight. We're going to get to that in a second, but Ms. Wade, could you describe the process whereby somebody might, when they're aware of a meeting, how they might sign up, the time in which they might sign up?
Yes, speakers can sign up to speak by calling the board. You can get that information on the website, or you may email board.of.education@rcsdk12.org and sign up to speak. Once you do so, you will be contacted with the Zoom link to let you know, or you may also email your comments, and those comments, when they're submitted, are posted to the website and also sent to all commissioners for them to review.
Commissioners, the Board of Education, members of the Board of Education really do, and of course our superintendent, we really do encourage you to send in your comments and even join us live in the Zoom room to share your comments, concerns, and if you have something positive that's going on, you can do that as well. Every Board of Education member is accessible by their own email. That is also listed on the website, and on occasion when we're doing yard work, which I've been doing this week, you sometimes can catch us in our community or at the grocery store. So we all encourage you to do that because we realize we are your servants. The best way we can serve you is to understand what your needs are. So again, we would encourage you to use all those different ways to connect with the Board of Education. Next item on our agenda is a speakers list. Madam Clerk, I think we have one speaker, and was there a written comment or no written comments?
No written comments. We do have one speaker, but she is not in the waiting room. So
Okay.
we're still awaiting her.
Well, I tell you what, we'll give her some time. Obviously, if she shows up as gets to the waiting room, we'll track back to her. But since we have our superintendent waiting in the wings to give us at least one report, I see that Superintendent Myers Small is on the agenda for discussing her plan to reopen the schools. And then we also have our Chief Financial Officer is going to provide us a report on COVID-19 assistance and funding. So Leslie, are you going to go first?
I am, thank you.
Yep.
Thank you, President White. Good evening to President White and all of our board commissioners, cabinet members, and those staff who are helping us tonight, as well as those who are watching us on Facebook Live. Tonight, I have the opportunity to discuss the Rochester City School District reopening plan. I have to start by saying that the 8 years that I've been a superintendent, I've had many complex tasks that I've been responsible for. And this by far was certainly one of the most difficult things that I needed to work on. We know that COVID-19 has presented many challenges just for us day to day, but certainly for schools and school districts. We are required by the New York State Department of Education to submit no later than tomorrow, Friday, July 31st, a reopening plan. And so the expectation is that we will submit assurances as well as information relative to the following 10 areas, and you can see them listed. So they range everything from how we will handle teaching and learning, how we will support the nutritional needs of students, taking care of social emotional well-being for both students and staff, technology and connectivity, as well as bilingual education in world languages. So we have been working literally around the clock since July 17th when we received the official word of what the guidelines or the expectations were, but we've been working previous to that. And I'll talk about that a little bit later in the presentation. So the first area is teaching and learning. And so we needed to prepare 3 different scenarios to the New York State Education Department. They include in-person, the hybrid, which is the combination of both distance learning and in-person learning, as well as distance learning. Rochester City School District, we would like to move forward with the hybrid model. For pre-K 4, K6, for special classes, and K-12 specialized programs. And I just want to give a little bit of background of why we are saying the hybrid model, so part in-person, part remote. Our students in pre-K 4 did not have, it's not that they didn't necessarily have devices, but if they didn't have one, they weren't provided one. We started at 4th grade and were able to move down a little bit to 3rd grade when I came on the scene due to a very generous donation. But our youngest learners have not had in-person instruction since that last day on March 13th. And that really went into our decision-making as far as why that area. When we talk about our students in specialized programs, so our students with disabilities, we also know that, we rely on the expertise of our teachers, and this is just another group that we know already potentially can have experience. They are experiencing learning gaps, and so we felt collectively as a team very strongly that it would be important, if parents, caregivers chose to do so, that those 3 very specific groups would have the option for a hybrid model. We are about choice with our students and their families choosing. So students not in school for that hybrid model would fully participate in a distance learning model. And we're working to fortify that remote learning for our students. And you can just see what the schedule would look like. So it would be in person Monday, Tuesday, then remote Wednesday through Thursday, or Group B, remote learning Monday through Wednesday, and then in person on Thursday and Friday. So we want to be very clear in the event that a parent is uncomfortable about sending their child to school. We know that some of our students have underlying medical conditions, or there just might not be a comfort level. So we will provide the option for the Rochester City School District online learning platform. We're asking that parents, it's a 2-week turnaround time, and we will be sending letters to families tomorrow, but we also will be making personal phone calls and doing outreach. We need parents to make a decision by Friday, August 14th to indicate that choice. And so we've already talked about a plan, a way to make sure that we determine who those folks are, what choices that our students and their families are making, so we can have proper planning. Communication and family and community engagement. Earlier this month, we did create and administer a survey to better understand concerns and questions that different stakeholder groups had regarding reopening of schools. We just want to talk to you just a little bit about it. And it is online on our website, and we did send information out. So of the slightly over 2,000, I think it was 2,033 staff who responded. When they responded to the question, in your opinion, which model would best meet the needs of our students as we plan for reopening in the midst of COVID-19? Of those 2,033, the breakdown was 47.6% hybrid, 27% in-person, and 25.4% remote learning. As far as families, we asked the question around whether in-person learning should resume with a modified schedule in place that includes both in-person and remote. And you can see approximately a third of both our families, and that response number was a little over 1,800. So about a third either agreed or strongly agreed that we should have both in-person and remote learning option for students. And you can see of the 384 students who responded, that was the lowest number of respondents on our survey. About a third also said they agreed or strongly agreed with a modified or a hybrid rather plan. Then you can see as far as should school resume as normal, where students, what is your comfort level? And you can see the breakdown there. That 5-day attendance, 38.8% strongly disagreed, and then 24% disagreed. And then you can see the student and the family responses literally mirror one another. So you have that data there. So again, tomorrow is the date that we must submit our plan to the New York State Education Department. The plan will be live on the website. And one thing that makes Rochester, there are many things that make Rochester's plan certainly unique and different, but unlike the continuity of education plans that were submitted during remote learning a few months ago, which was a district plan, each school/program must send. So we have 60 plans that we must submit to the New York State Department of Education. We will send an email first to staff, letting them know that the plan is submitted and what the options are, and also letting our staff know about the letter that we're going to be submitting to families. Then we're going to do a robocall out to families, letting them know that the plan has been submitted and that they need to get information back to us on August 14th. And then we'll really make sure that we are over communicating as far as sharing on our social media. We'll be doing direct and individualized reach out, but we really do need to understand what our families are choosing. And just going quickly back to the teaching and learning, because I didn't explicitly say this. So grades 5 through 12 will be online, solely remote learning. So I just want to make sure that that's clear. Health and safety is the next area. And so our plan needed to incorporate recommendations from the CDC, the Department of Health, as well as the New York State Education Department. We needed to provide certain assurances for student and employee safety. So looking at social distancing, engagement with visitors. And this is one where we are really rethinking this one as far as visitors, and we want to have further conversations with the board. We want our schools certainly to be welcoming and open, but just due to what is currently going on, I think that it would be wise for us to just say no visitors unless it's a parent coming to either drop off or pick up a child, that we would really need to limit it. And then we also needed to articulate how the interactions will be in shared spaces, classrooms, the gymnasium, restrooms, cafeterias, etc. We also had to submit information around PPE, health hygiene, hand sanitizer, cleaning and disinfecting, as well as health checks. And so we have a subcommittee who has been working on this for several weeks and months to thoroughly outline what that specifically would look like and what that would entail in the Rochester City School District. We're also responsible for child nutrition. And as I previously shared, we had those multiple sites across the city at places where we could maximize families and students partaking in those sites. And as I've previously shared, on average, we are providing about 23,000 meals per week to students. And so it is actively being used, and that people are participating in getting the meals for our students and their families. And so when we talk about child nutrition in the district, as far as what would students do if they are a part of that hybrid model, we have to social distance in the cafeteria. And again, depending on how many children that we have opting for the hybrid option, then we'd have to look at providing meals in alternate areas, maybe classrooms, staggered meal periods, et cetera, to ensure that the children are distanced appropriately and that the proper cleaning can occur. Transportation, and this frankly, board commissioners, this was where it really enabled us not to be able to transport all of our students to school 5 days a week. So there are very specific guidelines relative to transportation. And so we need to adhere to that must occur on buses as well. With our model, we would be using the yellow buses because our secondary students would not be coming to school. They would be doing remote learning, so there would be no RTS usage. So I think that's just important to note. We have to wear the appropriate face coverings at all times on the buses, maintain those social distancing practices. And we know that I know that this is the area that gives people pause of making sure that those masks stay on, both students and staff. And we will work very hard to develop almost like PSAs and other activities to make sure we really stress that importance and making sure that both students and staff are wearing the proper face covering. And we will be providing that as well for those who don't have it. Social emotional well-being has been something that is very important to me and very important to our team, and I know that it's important to the Board of Education. So under Deputy Martinez's direction, we have been putting together information that not only helps to address social emotional well-being of students, but also staff. I'm working right now with, she's actually a Rochester City School District graduate, Dr. Melanie Silas, who is a practitioner in trauma and health and counseling. She's a professor at MCC, and she's actually putting together some materials and training for me so we can really work with staff, but particularly our counselors, our social workers, our psychologists, and our nurse to do some training about what does it look like and what are some of the things that we just need to be particularly mindful for or of as our students come back to school, whatever iteration that is. We know that extracurricular and interscholastic activities, those are canceled per New York State guidelines. I've been following Robert Zayas very carefully, and he's been outlining what some potential models or options would be if athletics are able to come back up and running. Some of it's modified, moving some of the seasons around, shortening the season. So we just continue to be mindful. And I know our executive director, Carlos Cotto, has been following that and gets updates on a regular basis in that area. Attendance and chronic absenteeism. This is another big area. So attendance will be taken whether students are in the hybrid model, so when they're in person, but also when they're remote. And when you look at the guidelines here, board commissioners, when it's remote, it's about engagement and the interactivity that students have with the different platforms that we have up. So that is a little bit different than I think we're accustomed to with traditional brick and mortar attendance, but it is about engagement and how are students interacting with the learning materials. Technology and connectivity is also, it's a critical. So any student who is hybrid, but remote or solely remote, they need to have a device to do that remote work, as well as the internet to be able to connect their device to. I've shared before in previous meetings that under the leadership of Glenn Vanderwater and his team, they have done yeoman's work relative to getting information out. We have multiple devices that are out, and Glenn just briefed us this earlier this week that we will be able to provide devices for students in K through 4. So we'll be, or pre-K through 4. So we'll be able to do that. So and we're just moving forward to make sure that a device is not a barrier to learning. But I just want to stress right here, nothing does sacrifice that interaction and those relationships that our teachers certainly have with our students. Bilingual education in world languages is the last area, and so we'll continue to support our students who are bilingual and English language learners by making sure that we are providing the hybrid and distance learning materials to them, and it obviously needs to be aligned to their grade level and their specific instructional plan for them individually. So we have a district COVID-19 task force. That's the umbrella, and you can see just time to just plan. I think some people might think that we just started planning, and we did not. We've been working pretty meticulously and being very focused on trying to be as proactive that we can, given that we're reacting to some things as well. And we have another meeting coming up on August 11th. There are subcommittees, and so there's the planning and reopening operations. So that's Mike Schmidt's area, but there are connections to some other areas. There's the health and safety subcommittee, and then there's the instructional subcommittee. And so we do have representation from different factions in our organizations. In our organization, I do want to be clear that we have built that representation. It was not always there. I'll be clear about that. On my arrival, though, we did make sure that we added additional individuals to hear from the different lenses, to make sure that we were taking into consideration the different needs that exist from the different aspects of our organization. So this is just a little bit of the decision rationale of what we just looked at. And I just have to tell our commissioners, or just reiterate that, again, not an easy decision. And as I shared with President White, no matter what decision Rochester City School District made, there was going to be concerns. There's going to be people who are not happy. And I think that makes it difficult. I know that I can't be a people pleaser, but I want to make sure that the plans are meaningful. And so I know that there are different concerns, and this is a very complex situation. But I just have to say wholeheartedly that we have worked as hard as we can to put together a plan that we believe works in our district with the population of students whom we work with the ability to get technology into hands of students and the decision making that went into that. We just feel very strongly about making the decisions that we made. And again, I know that, people are not going to agree with it, and there's certainly concern, and I acknowledge and I understand that. So what are some next steps? And these are not all of them, because when you see the plan is 63 pages, or is it 67? Melody, please. It's in the 60s. It's a lot of work, and there was a lot of thought put into it. When you see the plan, there might be questions. Well, what about this? Well, how are we going to handle? So, for example, this first one, if we have staff members who have compromised health systems, or have medical issues, or take care of a family member, whether a child or have an adult parent or an elderly person in their home. So we're working on putting that together and figuring out what that looks like and determining how we will process that. We also know that no later than Friday, August 14th, we need to make sure that parents get into us their decision about what option they are choosing, whether the hybrid or the fully remote. Then we need to finalize those schedules for our scholars and get transportation moving as well, no pun intended. We also know that on or before August 7th, Governor Cuomo will announce his decision regarding school reopening. And so I think that's the other frustrating part, frankly, is that we work hard to put the plans together based on our best thinking, but that can be moderately to substantially changed depending on whatever decision our governor makes. We also are working with some partners, and I'm looking forward to coming back to you maybe within a week on identifying additional supports to assist students with online learning. So whether it's the hybrid or full, and to the degree of what that happens in our district, I continue to be concerned about fortifying online learning. And so I'm just looking at unique ways that we can ensure that students have those supports when they are online learning remotely. And then we will have to have this is important, the discussion with the unions. I know there's that committee, the calendar committee, I believe we call it, relative to moving some or all of superintendent's conference days to the beginning of the year, to allow time for appropriate professional development and training and things that we need to make sure that we're on the same page with. So we're going to need to make that decision soon of whether we'll start day after Memorial Day, but add 1 or more days and either start on that Friday or that following Monday. So I just wanted to make sure the board was aware that that's something that we will hopefully be coming back to you with. We need to solidify that. So that is the reopening plan in a nutshell. There's obviously many more layers to it, but that's a topical briefing on what we're looking at.
Leslie, I've opened up my participant screen, and I'm just looking to see if any colleagues have any questions for you.
Sure.
Anybody have any questions for our superintendent? Don't. So Commissioner Powell, and then I see Commissioner Powell.
Yeah, actually, my first question was prompted by the picture in one of your slides that showed a graphing child with a graphing calculator, and so the question that prompted is for the secondary students
Mm-hmm.
Who are taking higher level math courses. They all have laptops, or not laptops, but Chromebooks or something. But what about students who need a graphing calculator and whose families can't afford to purchase one for them?
Sure. Either Shirley or Carmine, do you mind chiming in on that? And I don't know the extent to what we've talked about that, but is there anything initially that you could provide to Commissioner Powell?
Well, I know we have graphing calculators that we provide with our students, so I could work with tech to figure out how we can get them in the hands. I also know that the Chromebooks have an extension which you could use and use them as a graphing calculator as well. So I could also default. I know Tim is here as well, so
Okay.
Tim.
So as a follow-up question, I only want to know if our math teachers are well-versed in that technology so that they can coach their students. I'm sure all the lesson plans are currently set up to, walk a child through the use of a particular model of graphing calculators. So this would require a certain degree of modifying their lesson plans, yes?
So I think the graphing calculator, that's an extension of the Chromebook, and I see that Tim is here right now, is
Yep.
the same image of the graphing calculator they use. So it is the same functions, the same buttons as they would use on a regular graphing calculator.
And just to add to that, Commissioner, part of the request around having the additional days for training, those are the kinds of things we would work with our teaching staff on, how to ensure that they have the resources and the skill set to use the digital technology.
Thank you.
I see Commissioner Adams has his hand raised.
Yeah, I have a couple questions here. I just want to be clear about the August 14th letter. If our kids are above 5th grade, we don't even have to worry about that. We
Correct.
don't have the option. Okay.
Correct. 5th and above.
Okay. Is there going to be a no tolerance policy about the mask for staff?
What do you mean by that,
In
Commissioner?
reference, there's a lot of people in this community just feel that they don't need to wear masks. It's really an unbelievable amount of people, including police officers and everything. So I just hope that we have a no tolerance for no masks.
You mean of making sure that we are wearing masks?
Yes.
Right. Okay. Yes.
Absolutely. There should be no exceptions for that. The last thing is that you had you listed RTA and these different groups.
Mhm.
I think this is a new era that we're reaching, and I think the Office of Parent Engagement should be involved. That's a bridge to parents, and I think we need to have them utilize them more for what they're for. There's going to be a lot of gap. I think we're going to need all hands on board, and I just didn't see their name listed with RTA and all that. I just think we should take advantage of a group of.
Good. Deputy Martinez, would you just address that, what you've been?
Good evening. Yes, so we do have, pardon me, I don't know everyone's names fully yet, but Khadijah has been part of some of the subcommittees.
Okay.
Yes.
Thank you.
You all set, Commissioner Adams?
I'm all set.
Commissioner LeBron?
Hey guys, all right, so I have a couple of questions. So I try to write them down, Dr. Myers-Small, as you were talking, and I did read the plan on the way. I was traveling back today. 5th through 12th grade online. I'm curious around whether the teachers will be allowed to also work remotely to minimize staff also in the building.
So we're working that out. So 5 through, are you referring to 5 through 12 working remote?
5th through 12th grade, because my understanding is 5th through 12th grade are all going to be remote learning, and then K through 4 will be, parents will have some options around that. And I have some questions. I have some additional questions. I don't know if you want me to read all of them or you want the ability to answer them one by one.
Can I take them one by one, if you don't mind? Okay. So 5th through 12, I think what's important is that with remote, we would want to be able to provide that option. I mean, one, we'd have to first look at the medically fragile individuals and look at that process. But we also, we want to make sure that we don't have tons of folks in the building. So we would be flexible. That's something that we are, working out right now as we speak. So that is something that we're looking at. Yes.
Okay. And then I guess my questions are all K through 4 allowed to opt into online only format if that's what parents choose?
It's about choice. Yes.
Okay. And then are letters going to be sent to the families in their spoken language?
We're working on that too. Yes.
Okay.
Yes. That's important.
So I think about, School 15, which is where Sophia goes, multiple languages spoken there and making sure. And then what happens if a parent opts in to have their child do the hybrid model, but then decides after the deadline that they've changed their minds and they want to opt out, I guess? I don't mean to use the word opt in or out, but
right. We're trying not to use that language.
Will they have the opportunity to do that past the deadline?
I think we would have to, right? Because there are extenuating circumstances why we need to make some decisions is because we recognize that people are going to have work situations that are going to be fluid, including our teachers, as well as, medical things could change. So we're going to have to be flexible, but we just need to get a sense, at least, what we think it looks like.
Okay. And then is it possible, so this is I have some budgetary related questions too.
Okay.
Because I had class today also, and some things have come up even today with education and laws, and I'll talk about that later, but
Okay.
is it possible for us as a board and as a community to see a separate COVID-19 related budget? So not an entire budget, like our budget is almost 1,000 pages of everything combined, but a parent, spreadsheet at minimum that shows us school by school related COVID expenditures and central office related and shared expenditures COVID related. Is that possible for us to get?
So Carlene would answer if she unmutes herself, but we are working on that. We've already started to look at what the supplies are. We were able to do some things in 1920, but Carlene is already on that, but I'll pass the torch to you.
Okay. We absolutely have set up a subclass for the capturing of this information. And what that's going to do is it dovetails nicely into the next presentation we have on the COVID relief, if you will. We have created a subcode known as 1003, and we are asking that whomever is processing the requisitions or the requests to use that code, and then that way we'll be able to capture that information, which will then flow right into either FEMA or CARES funding, whatever source we decide to use. So we will be able to provide that to you. It's not an issue.
And then I guess I'm going to ask about, so I have some notes that I was writing on the way here too. So on July 1st, the Department of Education around CARE Act funds. Are you familiar with that rule, Carlene and Dr. Myers-Small? It says that districts have two options to spend their CARE Act dollar funds. And so option one allows the district to spend the funds on low-income, non-low-income schools. And if the district chooses this option, the district has to set aside funds to provide equitable services for private school students based on total private school population, not just low-income private school students. So they gave two options. And then option two, it allows the district to just spend CARE Act funds on low-income schools. And under this option, a district that has low-income, non-low-income schools, or a district that has only low-income schools can choose to spend CARE Act funds on low-income schools only, and can set aside the traditional percentage to provide equitable services for low-income private school students. But then it says under this option, low-income children who don't attend low-income public schools are left out entirely. And I was just wondering, given, I don't know what's going to happen with us in CARE Act dollars at all. If we are also having these conversations and making, I guess, a decision on which option this district is going to move forward with.
We absolutely are, and we're right on top of that. There are actually, as you mentioned, it's option one and then option 2A and 2B. And that is information that's contained in the next presentation. I'm happy to get into that now, or if you'd like to go through the next presentation when the time is right, we can do it at that point. Either way is fine with us.
Okay, Carlene, I probably will ask to meet with you before you give the presentation, only because I think I may be joining a group of other board members across the country who are going to fight this, primarily because it just doesn't really make sense, especially for urban school districts. So, but I'm interested to hear your perspective on it as well and what you're presenting. So I have a few more questions, Van, and I don't know if anyone else has their hand raised. I certainly can stop asking and let others go and then ask again.
Natalie does, but if the questions relate to finance, why don't we just save them for Carlene's presentation, because that is on the calendar. We discussed this in the officers meeting, that there should be, part of this plan should include the financial implications, and I think that's what Carlene is going to do in a few moments. But I do see Commissioner Shepard has some questions, and then I have just a couple. Commissioner Shepard?
So I have two more questions. They're not technically finance related, but
Okay, well,
I'll just ask these two, but they can be part of Carlene's next presentation. So just interested in understanding the cost of the trainings around social emotional, how it will fit into the work and the work that's already been established in this district and the way that they've been trained and how we do restorative practices in this district. So interested in understanding how those will gel and mesh together, but also the cause and the measurement for effectiveness for those. And then my last question is staff who are in the compromised pool. I did see in the plan something that they should be, certain individuals should be speaking with their doctors. So what happens if their doctors do come back with medical documentation to say, you know, my patient is compromised immunes and should not be directly working on site. How are we going to be prepared to address those issues?
So Steve, would you handle the last part, and then I'll go back to the training.
Thank you.
Sure.
That's it for me.
Yeah, I've been working with the benefits team to come up with protocol for what medical documentation will accept as far as there's several different overlaying laws too that we're dealing with. Some deal with dependent care, some deal only when the individual is themselves immunocompromised, and we don't have a real good handle on the volume that we're looking at this point. But as we start to get a better idea of that, we're going to try and have to shuffle the deck as far as remote learning assignments versus in person, in the K4 and the special ed arenas. What our real ultimate goal is to get as many people who are medically incapable of coming in into remote learning environments, and those that can come in, to shore that up, just to maximize our resources of our teachers. Because, what we don't want to do is end up falling short by just having people go out on leaves without the ability to teach. So what we're seeing a lot of notes is, this person needs to be assigned to a remote learning environment. And so, my HR department and with the benefits group in there is trying to get a handle on just the grades those are for. And, obviously if they're secondary, it's not a problem. They're all remote learning at this point anyway. So yeah, we are actively building all sorts of models around how that's going to look. And we've conferred with, Buffalo and Syracuse as to what they're doing as well. Places that would have similar volume as far as managing that. So, yep, we're preparing for what's going to be a lot of shuffling, I think, at this point.
And then just going back to your training question, Commissioner LeBron, Melody has been working very closely with the Rock Restorative team and getting a sense of what all of that training looks like. So some of that information, not some of it, the information will be reviewed. And this is really, we're looking at the intersection of certainly trauma because of COVID-19, trauma that our students just experience day to day, of their regular lives. We're looking at the trauma of the murder of George Floyd and that racial trauma that exists. So it fits into our framework. We just thought we would have someone who could be very familiar with what we're doing in our district, but give everybody an opportunity to get that training and not have to let everybody have, all of our social workers, all of our counselors and psychologists get it and not have them be upfront training. But it is very aligned to what we're doing.
I guess I'm sorry, Van, I have one follow-up question to that, and it's just, sorry, I muted myself. My concern is also that we don't have a executive director of social emotional at this time.
Yep.
And so I'm not a big fan of consultants. I think I will say that right now. And so it is nothing to the individual. I just do not personally like to have short-term, I guess, solutions to long-term concerns and issues that we face in this district. So, I mean, and I do recognize that with COVID, there's so many moving parts and everything is changing rapidly from everything we've ever known. So I will acknowledge that it makes sense in this regard, but long-term, I'm still interested in ensuring that there is someone internally that knows the K-12 system, which is vastly different from college environment. And someone, you know, who is reflective of our community, of the city of Rochester, that knows our students, knows our school culture, all very different things. But I do recognize that trauma is trauma. And if you have that experience, that you can maneuver and work around that, but it is vastly different than when you're either internally embedded and you have those relationships and those connections internally.
Agreed.
All right.
Thank you. That was all.
To my colleagues, if you are not, after you finish asking a question, if you could press the button to put your hand down, because I'm not sure whether you've raised your hand again or whether you just left your hand raised. I don't have the capacity to put your hand down. So I got one more person, if I'm correct here, and that's Commissioner Malloy. Commissioner Malloy.
I thought you said that I was next.
Oh, I'm sorry. I was looking at the list. Commissioner Shepard, you are absolutely right. You're next.
So I wanted to ask, are there any significant changes in enrollment when we're talking about funding for the district for this year?
Are you asking, did our enrollment significantly decrease?
Change.
I'll have to get back to you on that. I'm not sure. Callie, if you'll just add that to the log for me, I'll get that back to you and everyone else.
Okay. And then when parents decide what option they want to do, is that just for the semester, or is that going to be a year-long option?
I think we have to either take it, I think we have to take it for the semester, right? But again, we do have to employ some flexibility because things can change, but we want to at least get that initial number to know what is the transportation going to look like, you know, and what do we need as far as staff in our respective schools or programs.
And then we touched on 5 through 12 staffing, but for our pre-K through 4th grade staffing, will they get a choice regardless on if it's medical or not? And so if we do have staff who are going to choose for whatever reasons that they believe, you know, for safety reasons or whatever the case may be, they have other situations, they have kids in school that may have to do remote learning, and so it's going to be difficult. What kind of plans or will they be losing their positions? Will they be terminated? Or will they have the flexibility to choose?
Steve, would you respond?
Sure. To the extent that it's because they have students that are home due to their schools having, you know, COVID closures or partial closures, they would also have, you know, a right to assert under some of the laws that have been passed recently for COVID. So we would have to be finding remote options for them to the extent that we can also. Otherwise, they're entitled to leaves. And again, we're trying to maximize our people by getting them into remote learning situations as much as we can in order to keep assets in place and not have to go to sub-pools, which are not overly productive. People who just choose not to come, though, you know, we're not at this point until we see what kind of volume we have for people who cannot, either medically or due to their childcare situations. We're putting the choice people who don't have other reasons just kind of into a waiting pattern to see what the volume looks like, because it's, you know, as between weighing the three options, the medically fragile, those with childcare issues, and those who just don't want to come in for personal reasons. You know, we have to put those at the back just to ensure that we comply with our legal obligations. So we are building a pile of those as well. We're gonna try and assess volume. And if somebody chose not to come in, you know, for personal reasons, you know, we haven't really come up with a scenario on that yet. As to whether they'd be directed to come in. Probably makes a difference if they're tenured versus probationary. As you know, there is a greater right in that respect. Haven't really gotten to that point in the thought process because we haven't seen the volume. At this moment, sitting in the queue, it's not so overwhelming that we would, you know, that we're looking at something that's we can't manage. But it's still early, and I think a lot of people are waiting to see what learning environment we're going to end up in also. And even after, we put in our plan, it's, as you see, not really our call, depending, potentially by August 7th, we could be in an all remote, which takes a lot of these ifs and whats out until we try and reopen, at some later time. So, we're just preparing for a lot of contingencies, but at the same time, trying not to get, we could come down and start answering people, and then the whole thing could change on us. So we're trying to be thoughtful on this as best we can.
And then my last question is about paras and TAs. With the changes that are being made, what does that look like in regards to the work they're going to or not going to be doing, and then how that impacts our budget?
Steve?
I think I can partially answer this.
And then Keisha.
And I may need a little backup from our chief of special ed. I think that they've been obviously fully budgeted for whatever volume we have. I've been in some staffing meetings where we probably will need less overall. There are a lot of kids that have one-to-one paras, but when we dig into those, it looks like some of them are for feeding and hygiene, and if the students, depending on whether the students come in person or not, would make a difference to where we need those particular individuals. Certainly, to the extent that it's required, we will have them, and we'll find ways to get them, even in a remote environment, as we did in the spring. There are kids who need one-to-ones to help them learn, and we're trying to figure out good ways to get access to technology for their paraprofessional or one-to-one aid. But I think overall we will be looking at, we are counting on some decrease in paraprofessional usage, certainly. To the extent that some of that is subs that we use currently, that would just be not using the subline. I'll let Keisha kind of flush out some more of that, but there will be a reduction to some point.
Yes. Good evening, commissioners. I would agree with that. There certainly would be a reduction in some of the support staff, both paraprofessionals and teaching assistants. For the students with disabilities that will be receiving face-to-face instruction, of course, we'll have our paras and our TAs in the ratios that we need in our classrooms. But for our students that are receiving remote and distance learning, that's where it becomes a bit more complex. So the use of our paras and TAs, we're still working through what that's going to look like. There are some challenges with their, like Steve said, with their technology that they have and their connectivity from home and those things. So from the remote piece, we're P through 12 who will be receiving in-person instruction, we will be utilizing our support staff, both our paras and our TAs.
You all set, Commissioner Shepard? Okay. Commissioner Malloy?
Thank you. First of all, thank you, Superintendent Myers-Small, for your work on this. Thank you to your entire team. I know that it could not have been easy. I know so many districts are grappling with these same questions, and I think you've done a marvelous job in trying to foresee a lot of this. So thank you for your work. It's much appreciated. Just to piggyback on what Commissioner Shepard just said, she was referencing our special education students. That's one of my major concerns. I really want to make sure that we are meeting the unique needs of our special education students. And I worry of being able to do that in any model, but especially in a hybrid model when kids aren't in school every day. I just can't even fathom what that's going to look like in many instances. So I have a lot of concerns around that, and I know that your team is working on that. But I hope that we can ensure that our special education students are getting what they need and what is required by law. So that was the first. That was more a comment than a question. My primary concern, I would say, is how are we going to ensure that we are keeping our students truly safe while they're at school? I know that we're going to be going through like how we're going to be paying for cleaning supplies, et cetera. But how do we ensure that so that families are feeling secure? The logistics are just so massive, and it's hard to wrap one's head around. And so I do worry about that, especially in the hybrid model. We have families that have spent months creating now this protective bubble around each of their own families, like a safe zone or safe pod. And that pod often includes their extended family members, including elderly family members, grandparents. And I worry that by switching to a hybrid model, we are disrupting that entire safety zone for those families, and possibly also interfering with the social and emotional needs of so many of our students who depend on their extended family members, especially their elderly grandparents, for those types of supports. And kids have seen so much change this year, and I worry that we aren't going to be able to adequately provide those supports. But I also worry about students not having the ability to see extended family members who often offer childcare to many of our students. And so that kind of brings up the whole childcare issue. Anyway, let's start with the maybe the safety piece first, and then I'll piggyback with another question.
So I wish, this is the question that I think every superintendent is getting asked locally, regionally, statewide, and across the nation. How can you assure? And we can't. We can put protective measures in place, and I know this is what gets, staff upset, parents, etc. We do the best that we can to adhere to the guidelines, to make sure that we're masking, that we're socially distancing, that we're hand sanitizing and doing the hygiene. I've had conversations with Dr. Mendoza, Dr. Cindy DeVore, our medical physician. I've talked to other superintendents. We do people, I know people are, reporters are tweeting as I talk tonight during the board meeting. We're doing the best that we can, but I mean, it's the same thing when we say, whenever we go out, we can't assure that when we go here, there, and everywhere. And even when groceries were being delivered, people got COVID-19 from that, right? So we do the best that we can. And again, that's why there's also choice for our students to say, if they are not comfortable, we had a conversation, Commissioner Malloy, I have to make a choice that I'm not gonna be able to see my 83-year-old mom, right? Because I'm gonna be out and about, and when school starts with the hybrid model, so I won't be able to physically see her anymore. And that's hard for me. Thankfully, I have another family member that is, helping with that. But that's what makes it so complex, right? If it were easy, I'd be able to say, yep, all of us can come back, right? All of our students can come back. But we are working hard to make sure we adhere to those guidelines, that we have the resources in place. So Mike and his team have been working. We've been working with Aaron Grotman over the medical piece, the nursing piece and all of that. But it's complex. I get it.
That my preference is to start the year remotely, and then once we know more about this virus, that we ease into something different. But of course, that's not the entire community. We have people who really want to get back into the buildings or have the hybrid model. So I respect that. But I do worry about childcare, and that's my next question. I know that with some of our students who will be in classrooms under the hybrid model, 5th through 12th grade, I believe, or no, they'll be remote learning with 5th through 12th grade. I worry that, we have families who have different grade levels. And I know that for my own family, at least, I will have a 3rd grader who will then be by themselves during the day, unless I find childcare for them. I think that a lot of families are going to be in the same situation. And we already know there is a severe shortage of childcare opportunities in the city of Rochester. So I'm wondering what the district is doing to assist with finding viable childcare options for their children.
Mm-hmm. I'm working. Thank you for that question. Again, that is the one where I was saying, Governor Cuomo, please make the decision now so we can know what childcare is going to potentially look like for those families who need it. I'm doing advocacy with the commissioner and the chancellor. Monroe County Council of Superintendents, we are working to advocate Council of Great City Schools. But, you know, I'm also knowing that you can't just advocate. You need to have active plans in place. So I'm having conversations with the city of Rochester, and I talked to Dr. Lucas yesterday, Candace Lucas, and I said, we need to sit down. I have some, you know, childcare concern issues. So we're working on trying to develop those partnerships or to make sure that we can provide some resources for families. But that's, again, what adds to the complication of that. So if we are fully remote, then I'm not trying to ping pong this, but that increases, right? We've got to figure out. So regardless of what we're doing, we need to try and figure out how to help families. It's quote unquote not our responsibility, but we have an obligation to assist.
Yeah, and I just worry that we're going to have a lot of families who are opting to maybe leave their children alone because childcare costs are exponentially high in our country, and we have many families that have been out of work for quite some time, and mom and dad have to work, but you know, their child has to stay at home by themselves. I worry that we're going to have a lot of kids all by themselves.
Commissioner Malloy, I appreciate you saying that, and thank you. It opens the door for me to say, when I've been putting out in the, in the media sphere, whether it's social media or talking with the media, that's one of the things that really distinguishes the Rochester City School District from the other Monroe County schools is our poverty level, right? The economically disadvantaged population that we have, that's higher in our district. And so many of our parents, many of our caregivers are those essential workers that have to work. And the options are very limited to none as far as what do they do relative to their children. So they have to go to work. They can't take vacation or they can't take a day off here or there. And that's my worry. And that's the balance. And that's the complexity and the difficulty of trying to balance this all out, where many of our suburban counterparts don't have some of the issues that we have to grapple with. And so that, again, is what keeps me up. That's what has gone into our decision making. And again, the plan that we are submitting to the state represents that best thinking, given all of the dynamics that we have in our district.
And I certainly appreciate that. Just one more question. What is the ripple effect that you foresee across the district if we do have an outbreak? And I know this is probably a question that every superintendent is getting from staff members, but I don't know logistically how we are going to be able to effectively handle that.
Mm-hmm.
With 26,000 students.
Sure.
What do we do? Do the teachers have to stay home for 2 weeks? And I know we'll be going by guidance of Monroe County and the state, but how are we logistically going to make this all happen?
Sure. So Dr. Mendoza has become my BFF overnight. And, I've already had some initial conversations with him. I'm on the phone with him once a week with my colleagues from Monroe County Council of School Superintendents. We have an individual meeting coming up. It's tomorrow's Friday, so it's next week. But I really want to figure out from him what exactly it looks like. We did a press conference today, and that was a question that was posed to him. What does it look like? It should be a uniform response. His response was really spot on. He said, there are so many factors. It determines the size of the district, what you have as far as folks who have been infected in that particular community. So he really is not doing a one-size-fits-all approach. He is working very specifically, and I'm so grateful that as superintendents we have that relationship with him, because he's getting to understand the needs, the specific needs in our respective school districts, so he can work a specifically tailored plan out with us. But it is, once we know that there is a confirmed case, we work very directly with the health department. Months ago, when I was with the state education department, I watched the press conference and looked at what Superintendent Kathy Grotman did in Greece, and she partnered very closely. So we would be working very closely with him. The board would obviously be involved in decision making and having conversations as well. But the first step is to work with Dr. Mendoza to figure out that plan. And is it just the classroom? Is it the school? Or is it clusters? in the school district or the entire district.
Now, just a comment, and thank you for that, but just a quick comment and a plug maybe for neighborhood schools. A lot of this planning would be a lot easier if we had, and from a public safety or health point of view, it would be a lot easier if we had neighborhood schools in place. Kids wouldn't have to travel far, we wouldn't need as much transportation, but we don't have that, unfortunately, like other places. Have you seen the plans for other districts, and is our district in line with what you've seen in other districts?
I haven't seen the actual plans, but as I said, Dr. Nelms is on here with me as well. We are on meetings twice a week, Mondays and Wednesdays with our superintendent. So we are brainstorming and we're working together and we're having conversations. So, so we are getting information about how are they handling human resources aspects? How are they handling, what do classrooms look like? What grade level bands are hybrid or what are fully returning to school? So there's overlap, but as far as, I wouldn't say, and correct me if I'm wrong, Dr. Nelms, there's no one school plan the plans aren't identical. There are identical pieces of the plan where there's significant overlap. Would you agree, Dr. Nelms?
Yes, Dr. Myers-Small, and I would say the schools that are similar have very similar plans. Rochester is unique because there are no other schools like us except the Big Five.
Right.
So we have very small rural schools that have very similar plans, and to your point, schools that have require less busing because they're neighborhood schools, they have different plans, and schools that that kids have, like some schools are able to drive, like the large number of seniors and juniors, they don't have to worry as much about transportation. So there are a lot of factors that go in, but schools that have similar issues are more tightly aligned. But to Leslie's point, we were meeting 3 times a week and then 2 times a week and having very deep conversations about plans and not just presenting what we're doing, but having our colleagues poke holes in the plans and ask deeper questions, and then people were modifying and adjusting. I think, and Leslie said it earlier, the big decision will be late next week when the governor gives his direction. Things could moderately or drastically change. I mean, it can be as extreme as him saying schools can't open. So we'll have to see and wait. So these are all tentative plans. And I believe that this plan best reflects what we need to do for our school community. Again, whatever plan comes out, someone's gonna have a problem with. And so I think there was a careful consideration for the many factors. And this is a plan that Leslie and her team, with the input of a lot of different people, including community folks, decided was best, and I fully support it.
Were there any districts that went fully remote?
None.
Okay. Well, thank you for answering my questions.
Not in Monroe County, and not even New York City, no. And I was actually on a call with, a Zoom call with Chancellor Carranza, and he said, because things are improving in New York City, which was the hot spot, they're even looking at additional in-person options. He said that just today.
Thank you very much.
It is now 7:11 and we're supposed to be done with this portion of our agenda at 7:15, and we still haven't heard our financial implications report. So Leslie, I have a couple questions, a couple quick comments, a couple questions.
Mm-hmm.
They're going to be like lightning round questions. You can give me a quick answer, or you can send me an answer in the email. That's okay too. First
Callie,
of all,
if you just make sure you catch this just in case, thank you.
All right, here we go. First thing, I want to thank you and your team for putting together this plan. These are unusual times when I know you've spent a lot of time on this, but it really wasn't enough time. This is a Herculean task that you guys were asked to put together, and we appreciate that. The board appreciates that. I also want to note that you're sacrificed in terms of your mom. Many of us, I know, you are one of many people who are having to make very difficult decisions like that in the context of work. And so we recognize that sacrifice and the sacrifices being made by lots of people who aren't able to see their family because they've got commitments that might jeopardize that health. So by recognizing you and saying we appreciate that, I think I can say on behalf of the board, we recognize and appreciate our staff members who are also making similar sacrifices. I also, on behalf of the board, I want to thank Steve. people inside Beltway, people know this. Steve has stepped in and is assisting in HR to fill a role, and the board appreciates that, Steve. Leslie was right to pick you for the job. You have the institutional knowledge, but we appreciate you stepping in to fill that role. And I wanted to say that, and there are sacrifices there too. So in terms of my questions, I'm glad we have on the agenda financial implications, lots of questions. I'm the Vice President and I ask that you include that as part of this presentation. But we wait with bated breath to hear what Carlene has to say about the implications of this and where we get the money to support this. And any additional questions that I have for you, Carlene, I will make sure they get forwarded to her as well. Quick question about the buses, the yellow buses. Will there be matrons on the buses? Because these are kids, man. And these masks are going to come on and off. And who's going to watch these kids when they're on these buses, whether they're sitting the appropriate distance from each other, whether they're wearing the mask? Do we have a plan for that? Quick answer.
Mike, can you answer that, please?
Yes, certainly with our district buses, we will have matrons on those buses. We are working with First Student in Monroe to finalize some of those. I think when we have the final numbers from the schools, then we can better determine how many individuals we may need in order to properly supervise the children on the buses.
Okay. Thanks, Mike. In terms of the website, Leslie, you mentioned earlier on that I believe, maybe you didn't, but let me just ask, will this detailed plan be listed on our website?
It will, both the district plan and the 60 plans. I did witness the behind the scenes. It is very, very well done. So we will make sure first thing tomorrow morning, we get that link to you and you can click on it. And thanks to Melody and Carlos and his team, we have a very comprehensive website.
Okay, so citizens watching this program should know they want the detail that they're missing.
Yes.
They are able to access that through our website.
Yes.
Additionally, this is sort of a follow-up on Commissioner Malloy's question, maybe a little bit different, but this is a very complicated endeavor. You're attempting in 45 minutes to describe something that's extreme, that took you probably more than 45 days to put together. Stuff's gonna happen. People are going to have last minute questions. Things are going to fall apart. Is there because this is just the human condition, not that you guys haven't planned things thoroughly, but you're going to miss stuff. People are going to miss stuff. Stuff's going to happen. Is there a hotline where parents could call and say, oh my God, I don't have daycare. Who do I call for daycare? Or someone on this hotline who could triage logistical issues and challenges that parents are having, or maybe somebody forgot to pick somebody up. I think a bus driver or on a route, stuff is going to happen. And I want to make sure, and I'm saying this out front, on behalf of the whole board, mistakes and challenges are going to happen. It's inevitable. But I want to make sure that when the person says a mistake or a challenge has happened, that they know that there's a number or someone that they can reach to help them address these problems. Have we thought about that, or do we have an existing line that they could use?
We have an existing line which will be repurposed and dedicated to this. We also will have, I think it's called Reopening. I don't remember what the email, but we'll have an email that's right on that landing page for our reopening plans. That if you have specific questions, it's an email dedicated, so you can either email or call.
Okay, all right, because I think that's critical. People are going to be lost and, well, wait a second, or I want to change my mind, as one commissioner said. So when this line is staffed, my suggestion is that it be staffed with people who really understand this plan and how to get people to the right places. And then finally, and I think I know the answer to this, matter of fact, I just got a notice that on Facebook, and this is almost a quote, why are you guys meeting on doing distance communication, and yet you're sending teachers and students back to class? Now, let me first explain. The governor made this form of meeting available to us and boards across the state until August the 15th. And let me just say to the people who are asking that, it's a legitimate question, but it's a legitimate purpose by why we're here. Everyone should be concerned about the health and safety of every individual. So that goes without saying. Now, Leslie has a purpose, and we all have a purpose, is to make sure the children are educated. And so my response to that question is, we are meeting in this format because we're trying to protect the health and safety, not only of board members, of staff members, and our families, right? And that's a legitimate purpose. But when you talk about protecting the health and safety of children, and you also have a simultaneous goal of educating children, it's not as simple as saying, okay, we're gonna have a Zoom meeting to go through an agenda. It's just not that simple. And so our superintendent has tried to has developed a plan to address both those needs, to make sure that we address the health and safety of our children and make sure that our children get educated. Again, I want to say to those YouTubers and Facebook folks, our task here is quite simple, right? And doesn't require that we meet in person. But when you talk about educating children, it's a little more complicated than just going through an agenda. And so Dr. Myers-Small has attempted to put together a plan for addressing both those very important tasks. Leslie, did you want to respond to any of that question? Because it's a good question that they asked.
I concur with what you said. I'll say it's different, and people are going to say, that's a cop out. No, I agree that there's the added complexity of the teaching and learning component, and it's different.
In that regard, have you had any resistance from unions, and have you had any communication with them about the legitimate concern? Wait a second, why are you putting us in harm's way? I think that's a legitimate question.
So we've been, so I've met with the different unions. Yep, we've had some conversations, and again, that's why I said we've received concerns about what we were intending to do. I tried to be very clear that we were very thoughtful, and we just didn't jump out and say it's going to automatically be a hybrid plan. I worked many different scenarios through my mind, and so did the team. We thought, okay, could we do remote right now? Would we, and we went through many different iterations. It was not a foregone conclusion. I want to be very clear about that. It was very thoughtful. But just like we said that, parents and community members, we have our internal staff who have their concerns. And I do acknowledge that. And I certainly appreciate and I do understand the concerns that they've outlined. I am trying to respond to emails that I get as quickly as I can. And to date, I think I'm behind just a couple of days, but I'm responding, not my staff, unless it's a question that I can answer. I'm trying to be as careful and thoughtful as I possibly can be. We are trying to be as careful and thoughtful, but Dr. Nelm said it, others have said it. We know that no matter what plan we put forward, it's not going to satisfy folks, because we could say we're going to go remote and fully remote. And that's what we submit tomorrow morning, which is not what we're submitting. But if we said that, I have parents and I have community members. I got an email that said, if you don't have my child come 5 days a week, there's a group of us who are very angry, and we're going to stop paying taxes to the Rochester City School District because our children need to be in school. So you see these diametrically opposed perspectives, which I get and I honor and I respect. That's again what makes this so difficult.
Thank you for time. Thank you for taking the time to address that. And thank you for the and the message, asking us to address it directly. And I think you did that. All right, Carlene is next on the agenda. Carlene, can you provide us a comprehensive but maybe somewhat condensed presentation? It's important, so I don't want to short shift you. Go ahead.
As fast as you want me to. So thank you for the opportunity this evening to go over this with you. Hi there, Callie, I think put that up. Next one in, please. If you can take one more. I've listed for you the resources that we are aware of as of today to offset the COVID-19 expenditures that we are currently facing, and those that are yet to come, as Dr. Myers-Small had stated. we were also made aware of another funding opportunity, again, even as recently as today. We don't have any information on that, so I did not include it on this slide. I want to thank Carrie Pecor, the Executive Director of the Office of Grants and Program Accountability, who was really the individual, she as well as Judy Schuster, who works with grants as well, provided me the background information on these funding sources. So we will go through these three main funding sources tonight. So Callie, if you could, yep, thank you. Underneath the CARES Act funding, it's broken into two separate portions, as Commissioner LeBron had stated. You have the GEAR, which is Governor's Emergency Education Relief, and then you have the Elementary and Secondary School Emergency Relief Program. And when you take a look at those two allocations together, we're looking at approximately $29.2 million of funding that is coming in our direction. And the reason I'm saying that is because, go to the next slide, we will see that there's a requirement, as Commissioner LeBron was saying, that we need to act in an equitable share manner. And that means that we have 10 non-public schools in our geographic area, all of which are Title I eligible. And we have to split our money with them. And on the very next slide, we get to, it will actually go exactly to those options that Commissioner LeBron was speaking of. And so we did some calculations today in our meeting and going over these options with regard to how it would be considered to be equitable. The first option is based on total enrollment. And so based on that calculation, we would have to allocate, of the $29.2 million, $1.9 million would have to be allocated to those 10 schools. In option 2A, which is the low income based analysis and for all Title I schools. And in this option, we would actually have to take into consideration all of those students who are deemed to be low income students from all school districts who are placing their students within those 10 schools within our geographic area. That particular option, so in this case, it would mean if there were students from Greece, any Monroe schools, anybody that's sending their children to these schools that I've listed, we would have to provide allocation for those students. In this particular option, we would divide up the money so that the schools would receive $956,000. The very last option is low income as well. But what we're allowed to do here is to absolutely use the same percentage of allocation that we currently use for Title I funding for these schools. And the analysis that we've performed, this would right now be the most attractive option for us to utilize. In this case, we would allocate $619,000 to those other schools. So again, if you take the $29.2 million, subtract out the $600,000, we would have remaining then $28.6 million in rough numbers. So the next slide will take us through.
Arlene, Willa here. Can you just restate for me the dollar amount for option 2A? I didn't.
Yes, it would be $956,000.
Thank you.
You're welcome. So what we try to do here very quickly, and again, I'm not going to read this all to you, but we try to just list the eligible uses under each of these particular grants and the funding opportunities. And so what you're going to see here is an absolute dovetail into the reopening plan Dr. Myers-Small spoke of, and how those expenditures as it relates to the plan, many of them will be reimbursable under these particular funding sources. So we can just flip through here. You're going to see technology, childcare, mental health, well-being, and a good amount of the discussion in this area is going to be again on technology uses. When we move into the ESSER, which Kalia, thank you very much for going there. That's perfect. Again, the ESSER, which is the slide before, will actually show the eligible uses again underneath the ESSER funding source. And again, what you're going to see as you go down through the Dr. Myers-Small has already stated is being done within our schools and within our buildings And that is coupling in with the work of Mike Schmidt and his team, as well as Glenn Vanderwater. Then again, we have health-related services that we can offer here as well, for putting that up for reimbursement. What we've done, as described on the next slide, will show that we have put together a team of individuals who will meet on a weekly basis to review all of the opportunities we have before us to utilize this money. Again, to think about it purposefully and how we want to allocate this money out. And we have, as I said earlier, we started those meetings absolutely today, and we will continue to move forward. On the next slide, you will see that there will be members of Carrie Pecora's team meeting with the various committee members, subcommittee members on the school reopening plan, to just comb through the expenditures that we can identify in that plan and bring it to the forefront and start aligning that with the monies that we have available. And again, using that money to best meet our needs. If we go to the next slide, you're going to see, yes, that's perfect. We are actually learning more about FEMA, or maybe I'm learning more about FEMA as we go along. It's always a term that I've heard about out there, but I didn't know exactly how it would translate into money for the district. But in this particular case, FEMA is more restricted in the funding resources. It's a little bit more difficult to work with. However, as you can see here, we really want to look into this, because even though it's difficult, we have to measure our manpower hours, if you will, against the effort that goes into this. But certainly if we can be reimbursed 75% of all the eligible costs, that would allow the remaining 25% of those costs to be covered by CARES. That then in its own accord would free up additional money within CARES, so that we're not allocating 100% of the cost under the CARES funding. So it is worth looking into. It's expenditures that would be realized between March 20th, 2020 to September 20th, 2020. Again, we just have more work to do there with the county to understand exactly how we would tap into this. In all these cases, both within the CARES as well as in FEMA and the individual programs under CARES, we have questions into the state, as you can well imagine, just so that we can obtain clarification on how to use the funds, how to access the funds. We just have questions that we've brought forward that we need to answer to make sure we're absolutely remaining in compliance and in alignment with what the guidelines provide. On the next slide, you will see that under the FEMA, there's a small project and a large project. It's my understanding that Monroe County has absolutely gone after the large project. And that's what we're hoping, that some of the supplies that we are requesting, the PPE supplies, would fall under that category, and we would again seek reimbursement through the county for those expenditures that we have put forth to them. We have underneath, again, the eligible activities within FEMA, you're going to see repetitiveness here within these categories. And with that in mind, one of our discussion points today was how can we even take the grants that we currently are utilizing and perhaps shift some of those expenditures under CARE to thus then free up additional monies underneath, for instance, Title I. So it's like, if you will, a jigsaw puzzle that you're trying to take all the pieces, maneuver them around and best fit them so that we can absolutely maximize the dollars that we have coming into the district this coming year and then the next year. The very last slide talks about a carryover, and the more proper term for this, it's an absolutely allowable audit and compliance method of taking money from 1920 and moving it into 2021. And that's to identify certain expenditures that we know we are going to utilize prior to October 31st of the coming year. So what we did in that particular case, and again, through Mike Schmidt and Glenn Vanderwater primarily, we had accumulated $575,000 worth of transactions that were COVID-19 related. And so that money, the $575,000, if you will, was carried forward from 1920 and moved into 2021. So again, we have those supplies available to use in the 2021 school year with monies coming forward from 1920. So I hope I didn't go too fast.
You did excellent. I'm trying to, hold on a second. Talia, can you take down the screen?
It's down.
I still have the questions thing, so I can't see.
I think you're frozen.
Oh, am I frozen?
Yes.
I can see you guys. Can you see me?
Yes, but you're frozen.
Okay, well, maybe you can hear me. So does anybody have any questions? I can't see my participant screen, but just sort of yell out if you have questions, I guess.
Commissioner LeBron has her hand up, and then after that, Commissioner Adams.
Thank you. Commissioner LeBron?
Yeah, so a couple of questions. The PPE, though, my understanding is that there's just a shortage worldwide. So I'm just trying to understand how, I know we may have funds for it, but what are the actual chances of us having them on site by September?
Okay. I'll turn this over to Mike, but I do have to say that he's done a yeoman's job as far as getting his orders in and processing those through. He was very proactive at the end of 1920 and continues to be proactive as we move into 2021. So Mike, you want to take that one?
Yes, I certainly will. And really special thank you to Carlene, because pulling all this together and finding multiple funding options is going to make this much more manageable for us, not only in the short term, but the long term. So we've secured all the necessary supplies with which to start school, and the main items that we are, or a committed delivery date for those items. So we're talking mainly about certainly masks, gloves, face shields. Many of our teachers are even with the social distancing, speech therapists, kindergarten teachers, and so forth, are going to be generally in close proximity to the students. So face shields will be in place. They refer to them as a sneeze guard in some of the items, but a plexiglass divider between staff members and visitors or the public. Many like we have a central office right now, kind of a plexiglass in front of the countertop. All of our cleaning supplies, we have purchased 60 antiviral spray machines so that we can do a dry antiviral spray every evening. We've been doing that quite a lot, but we have enough now we will have enough for every building to have their own, and many other items like that. But that's generally the items we've been resourcing, and also trying to work with the county. So we don't have unlimited storage here, so try to utilize their storage facility so they'll deliver it to us on a quarterly or monthly basis. And an awful lot of this depends on the number of students that we have arriving in the first day, and then we can continue to resource and mobilize resources and continue to resource the problem, but also shift resources to other challenges we may have. And the last piece is we're really planning on a much more larger student number. Being really optimistic here that things go well, that we'll have more students as we go through. So we're planning for that contingency as well, depending on what the plans will bring us.
So we'll have supplies, is what you're saying, when school starts. I know you mentioned something about a shipment date, but I'm still waiting for furniture. I just want to put it out there. I ordered furniture right in the beginning before everything shut down, and I still have no furniture. And every time they give me a date and I call right before the date, I get a new date. So I just want to put it out there because
absolutely,
it's not as important as the PPE mask, but I just want to put it out there that I've been given dates multiple times already.
I tell you right now, I have an SUV, and I will go pick it up myself if you let me know where the location is. We'll take care of it.
I don't know. It's coming from out of state, but I'm still waiting for it. I also, not in the presentation, Carlene, and I don't know if you guys are aware of this, around the PEBT. So parents, if you are a parent that has a child in a free or reduced lunch school district, which our school district is 100% all free reduced. We're actually all free. I mean, at one point we used to do the application to do either free or reduced, and then we just went 100% free at some point in my kids' careers in the district. But PEBT gives each parent $420 of food stamps, and essentially all of our entire district parents should be eligible. So that includes UPK. It's intended for 5 years old to 18, but 19 to 21-year-olds still qualify if they're still enrolled in a high school that is deemed free or reduced lunch. And even if you don't get food stamps, you as a parent will get a card. It's going to look like a credit card that will, I'm putting it out there because I don't want parents to throw out if they get here's a card and they don't know what it is if they've never used food stamps. But that was supposed to cover from March until June, $420 of benefits. And I didn't see it in the presentation. I wasn't sure if you guys are aware, but that is supposed to be coming to our parents too. And I am working on trying to get more information out there because I would love for us to work not only with the county, but also potentially do some information sharing with our families around that. And my plan was to do that last week, like before I left, and then everything happened and I had to leave. And so I'm just coming back, but it is on my radar to finish getting more information about that. So the state has their information. I know locally, even some of the local Department of Human Services folks weren't even aware of it either last week before everything, because I was inquiring about it. So I do know that all of our parents should be eligible to get that $420 benefit, and it will be mailed directly to them. Now, if parents are currently getting Medicaid, that SNAP benefit may have actually dropped on their Medicaid card and they may not even be aware of it. So if you have a Medicaid card out there, you guys call the 800 number on the back. You might have some SNAP. But if you are not getting any kind of SNAP, you're going to get a card, a separate card. And if you are currently already receiving SNAP benefits, that was already deposited. You guys got the first deposit. So essentially, it's almost like a different type of stimulus, an additional stimulus. But I do know that based on our district and our makeup, that all of our parents should be eligible to receive that for each of their child.
We have not received any information, but Commissioner LeBron, I trust in your expertise, and I'll certainly look into that.
You all set, Commissioner LeBron?
Yes, and it's called
All right.
PEBT, Carlene, PEBT.
Commissioner Shepard?
I know that there was a slide about the parochial schools and the amount that we have to divvy up for those that are within our district limits. I wanted to ask what impact on transportation, what financial impacts on transportation will we have as a district when it comes to the private, parochial, and charter schools and BOCES for students who are not attending within the district limits, because I know we pay for transportation for those who live in our limits but go to school outside of those to a private or parochial school. So I wanted to know what impact that has on transportation financially.
Mike, do you want to take that one? Because I don't have that data.
So it's not unique for us to transport those children. We've been doing it right along. We would be able to provide you a much better breakdown when we have all the enrollments of all the different schools and how many students are actually going to be attending versus doing virtual. As far as information we have to date, most schools are very similar to us in the sense that a segment being virtual and a segment being in person. So once we have that final breakdown, probably more like mid-September, we would actually have a pretty good financial impact of that. But certainly the distribution of students and the number of buses, we would have much earlier in August. So it's kind of two different parts. They'll trail each other. As we get through this, we'll provide more information to come.
You all set, Commissioner Adams? Commissioner Shepard?
Yeah.
All right, Commissioner Adams?
So I'm wondering about this FEMA money. Is there some kind of clause in there to cover? We've told, I read the paperwork where people are supposed to self-quarantine if they have any of the symptoms. Some people can't afford not to get paid. So I don't know, but we need them to go ahead and if they have the symptoms, not come in. So is there going to be some funding to cover for people taking this time off self-quarantine? Because if we expect them to try to do that and it's going to cost them or they're not going to get paid, we're going to have a problem. So is there some money in that FEMA to cover for that?
I don't have an answer to that question, but I'll certainly look into it. I do know that the money that came forward today from the state, and again, was very high level. We don't know how much is going to be allocated to Rochester, but that specifically spoke to professional development and in the protection of educational positions. So I don't have enough information on it, Commissioner Adams, but certainly we'll circle back and get the information to you.
Okay.
Oh, with their certain new laws or regulations relative to the quarantine.
Yep, I was going to back up on that second part of that. So to the extent that it's the individual who gets sick or is suspected of being in contact with somebody, there are paid leave provisions available for them under both the federal and the New York state law. So it's not 100%, but it's 2/3 or 50%. So there is paid leave options in addition to them being able to use their sick leave through us, obviously, to the extent that that's what the cause is. So yeah, I mean, it wouldn't cover like a furlough situation, but anybody who is in contact, suspected to be in contact, forced into a quarantine, those kind of things, there are paid options available for them. Yep.
Thank you, Steve.
Yep.
Any other questions out there for Carlene? Carlene, I have just a couple, and again, you can answer them later. I seem to recall us, this is before you got here, talking about the CARES Act and the governor had swooped up some of that money. Did we include this money that you just referenced in your presentation in our budget?
To the best of my knowledge, it was not ever included because of the fact that the allocations just became known. So I don't know how they would have been able to determine how much to put in there, and I have not seen it on any of the reports that I've looked at.
Here's the crazy thing. They were steadfastly maintaining they could not and would not put it in there because the governor was going to take it. I'm not even talking about the clawback in the future. Bob had steadfastly maintained he would not put in the budget. So if this, is it 28 million? And I was steadfastly maintaining the governor could not, and we should include it in our budget. And there's lots of emails going back and forth because I said to Carl, this is something we ought to consider suing if the governor's going to do this. So this $28 million, you said it wasn't included because Terry was very cautious, very conservative, and he would not include that in there. So it's in there now? And how does that affect our budget?
No, this is not money that we have yet received.
No, I get it, but we will get it now because they were saying, I'm not going to include it in the budget because we're going to play it very conservative. We think the governor is just going to offset that by this maintenance of effort calculation. So eventually, this 28 million will go into our budget. How does that?
Yeah,
go ahead.
It goes into the special aid fund, and so again, it's not in the general fund. We will be taking money from, the costs that are coming in will be reimbursed under this. But again, I caution us, and I ask that when we are allocating money under these grants and these funding resources, that we think purposely about how we're utilizing it. We already know there are shortages within our budget. We identified that at the Finance Committee meeting. We don't know in some cases what yet we have to face this year. We know that we have a challenge before us with Iran and possible cutback in state aid.
Carlene, I get all that, but this is $28 million, which they said, and Carl and Steve might have been in some of those emails. I was going back and forth, saying in the meetings, wait a second, guys, we should include this. Oh, no, absolutely we cannot. And I've read that statute back and forth, and there are permissible uses of that money. And there are people saying, well, we don't even know if we're going to get the money. But my point is, with all the limitations you're talking about, before they were saying, we're not even going to include it. Now, at some point, that money may in fact come into our hands for purposes of, like, again, I remember the statute has to be used relating to the social psychological needs, high poverty districts. I get all that, but this would have to dramatically change our financial status. Would it not? Assuming that you can use all 28 of it. Now, that's a big assumption, but they were even saying the money wasn't available.
Right.
So I just, And my colleagues may remember, I would repeatedly get on these meetings and say, no, that money is going to be available. It is available. It's a competitive grant. It goes through the what do you call it? Local educational agencies, LEAs. And people were saying, oh, Van, you're crazy. But now you're saying the money is there. Maybe not in our hands yet, but that $28 million is going to significantly alter our budget.
You are correct. Absolutely correct. And the only caveat I can add to it is that this is a grant that expands over 2 years. So we just have to keep that in mind. But you're right, there's a positive impact here.
Sure there is. So we have to really, we got to be transparent about this. We have to revise our budget.
It would be amended. Sure,
in a major way. And it's incredible. I'll just tell you all, you all remember me saying this over 2-3. And there was no, and other people, commissioners say, oh, no, that's not going to happen. The government's not going to do it. We have the money. So my question would be, we'll put this in the question log. Can we get this in the question log to understand what the implications are, assuming that we get this money, how this affects our budget? Because I think it affects our budget in a major way, which is what I was saying. I mean, we did layoffs because we thought we didn't have this money. So please look into that. Then Connie, I have additional question, it's a comment. As you all know, I'm the designated member to this board to the Council of Great City Schools. I just want to tell you all that on Friday, the Council of Great City Schools filed an amicus brief on this very issue of equitable, they call it equitable services case. It was filed, I think, in the Northern District of California, and the Council of Great City Schools, which does represent our interests, joined New York City, Cleveland, and I think San Francisco in making the argument that how Secretary DeVos intends on distributing this money to private schools is inappropriate and unconstitutional. So I want you to know that there is active litigation on this, and Michael Cashley and his team, I happen to sit on the executive board, they are very hopeful that the litigation will result in a positive outcome. But of course, as Carl and Steve will tell you, you just don't know what a judge in a robe is going to do. But there are people working on this as we speak. Commissioner LeBron?
Yeah, I had to, I'm in the vehicle now, so I apologize. I'm starving. I've been traveling all day, so I just want to put that out there. But to what you were mentioning, Van, I just want to be clear that Bob also was very clear about not putting that money in there because we could not use those dollars for expenditures and the deficit that we incurred that had nothing to do with COVID. And so it is not that we would have budgeted that money and we would not have been able to not do the layoffs. And I think it's very confusing when you word it that way, Van, and it's almost false information with what the community will hear. So I just want to be clear to the community that there were very specific reasons, not just whether we would get that money or not. We were clear that the governor said he was going to keep the CARES Act dollars themselves, but the GEARS dollars, Bob was saying we could not use that money for our expenditures and our deficit that we incurred that had nothing to do with COVID. So I personally prefer that we did the budget the way we had the budget, that it was accurate. We don't have these dollars in hand, and I don't want to be counting money we don't have. And so we need to budget within our means, live within our means. And then now we have COVID and we have this pandemic, and we don't know what the total cost of the pandemic is going to cost the district. It sounds like a lot of money, but I don't think $29 million to provide mental health, childcare services, PPE, sanitation, additional supports and expenditures is going to be enough. I think that's a drop in the bucket for a district our size and with our budget the size that it is. So I'm concerned it's not even going to be enough. So I just want to put that out there. I don't want the community to be confused about what you just mentioned and make it seem that had we put that money into the budget, we could have avoided layoffs. The only way we could have avoided layoffs if we were realistic with our spending years ago. So I just want to put that out there.
So I just want to clarify, and people can look at the record. This was very clear what the administration was doing. They were in their rights, trying to be conservative. And it wasn't about whether we would be eligible or not, because if you look at the language of the statute, which it is very ambiguous, very open, it says this money can be spent in high poverty districts to address issues that maybe even existed before. The language of the statute was very clear. Everybody was concerned, not only about being conservative, but they were concerned about the governor taking money. And I maintained, I got emails to prove it, that the governor could not do that. This money was a competitive grant, competitive in quotes, money that we were going to get based on our title. So my point is, you say, well, listen, what about all this COVID stuff? We do know, by the way, that in addition to this CARES money, that there's this, which I've also talked about, there's this HEROES money that if they can get over the hurdle that the president has going on, even within his own party, we know that between the Senate and the earmarked for COVID. I'm not saying spend money that we don't have, but we should understand what the lay of the land is, and we should plan appropriately. The fact is, the prior administration decided to just not even consider this when I was saying repeatedly, this money is available, and lo and behold, it is available. Now listen, we don't need to talk about the past. It's water under the bridge, but I would like that question answered. Now what will happen to that money? Because there are all kinds of social workers, healthcare workers, that it doesn't even have to be COVID related. The expense could even occur before COVID on that CARES Act money. But my question is, how does that money, $28 million, which just happens to come up today like, oh, by the way, and it's not your fault, Carlene, we got $28 million. I need to know, the board needs to know, without regard to how we're going to spend it. I'm not saying, oh yeah, let's go ahead and spend away. I'm not calling for us to be less than the fiduciary agents we're supposed to be. But we are not fiduciary agents if we don't consider how this money is to be spent. I see Commissioner Powell.
So I think the reality is somewhere in between your two positions, President White. The thing about, you're absolutely right that we had every reason to expect that more money would come in, that we might be able to spend in ways unaffected by COVID. But until the money comes in, the best way to handle it, using conservative principles of accounting, is to treat it the same way we do federal grants that we don't know about at the time that we're preparing the budget, but that come into our budgets mid-year, which happens multiple times every year. That's why we amend our budget. Was it, Carlene, 4 times a year? Routinely, because the federal grants in particular get awarded after our budgets are passed, based on specific criteria that have to be spent specific ways. So the budget amendment will have both an increase in the revenue side and increases in the expense side. And for the listening audience, the most prudent approach is to treat this the same way we do those grants awarded mid-year. Especially, as Carlene said, it's over a 2-year period. We know that some of these funds will have to be carried over, or, well, whether they have to be or not, I'm not sure, but can be carried over into the next fiscal year. So I wouldn't make too much of a deal about it, President White. I do take your point. But you know, we have a process that handles these sorts of post-budgeting resources.
Commissioner LeBron? Something's going on. Commissioner LeBron, something's going on with my screen. Commissioner LeBron, can you hear me? I think I saw your hand raised.
I believe Carlene had a response though to the last point. Commissioner Braun, I think is still.
No, my hand was raised from before. Sorry, Van.
No, that's all right. Okay, Carlene?
I just wanted to offer some words of caution. We have already been advised of one grant that the state is holding back on right now because of the financial difficulties at the state level. So we have been notified that that particular grant is either going to be deferred or perhaps not approved at all. That means that we have to find alternative sources within the general fund to finance those expenditures. We're also currently looking at $10.4 million of expenditures we hadn't planned on. And that is all, again, coupled with the either deferment or the reduction in state aid. So I'm not trying to be a negative person by speaking those words of caution to you. I'd be happy to craft for the commissioners, all of you, a response to show you, the issues that we have before us, just to put it all out there for you, so you have a greater understanding.
If I should lose my audio, my computer is acting really strange. Vice President Elliott, who I know is there, she can lead the meeting. That's fine. I'm shocked that it just totally went off everybody's radar and then just appears as part of a casual conversation of $28 million. But my question a few minutes ago was and tell us how we reconcile all this. Carlene, you're saying there's some additional expenses, $10 million. That is something we ought to be on top of. And I think we all need to know about that, just like I'm just shocked about this CARES Act thing. All right, so Carlene, are there any other questions for Carlene? And by the way, Commissioner Powell, I do, with all due respect, I do think it's a big deal. I do. If you all could see half the emails that I sent about this topic, that we couldn't even, the governor was going to take it. It's mind blowing. It's a huge amount of money, and it just comes up in a conversation about COVID. And let me repeat, there is other money coming along the way, and I hope we won't be as tepid about that additional money. We are laying off people on these suppositions that turn out not to be accurate. All right, Carlene, I don't think there's any other questions for you, so we'll move on to the next item on the agenda, which is to recess to get some advice from our attorney, Carl Christoph. I don't need a motion to do that. I will tell folks, I'm not sure whether we'll come out and have the vote on anything. I don't think we will. If you've got family to take care of or kids to put to bed or to get some rest, go do that. And I'm sure you can find out through our website, rcsdk12.org, what your Board of Education is doing. On that note, I'm going to move into recess so long as there's no objection, and we're going to get some advice from our attorney, Carl Christoph.